Oh yeah, yeah, yeah. Today's black. Yesterday, what was it? It was
It
red
was
yesterday,
red.
and then yeah,
Seems
and now it's black. Yeah.
seems
So
like we are
I
coordinating every day.
I have a feeling. I have a feeling that you see me. You see me. Just a joke there. Anyway, I'm trying to share the Facebook post
I've just shared
onto
it as
the
well.
fantastic. But it's now on HRB Breakfast Facebook page and also on the Sunday Best um, Facebook page. Right.
Well, it's a
I
very
was,
good morning. I said I'm going to feed back to you about the London trip, and it went absolutely well.
that
I
was the first
must.
thing I was going to ask you, actually.
I read your mind.
Yes,
um,
the first thing I was going to ask you. How did the London trip go?
it went really well, Apoku. I felt so
Mm,
safe. I had a mask on during the entire journey on the train and
okay.
then getting to the London Centre, the Secure Mahikari Centre. And at the centre, as I've said before, they took our temperature. We had to wear a mask, wash our hands first, hand sanitize, maintain social distancing, and then when we were leaving, exactly the same process. So it was very, very well planned, very strict
Mm.
guidance. And the whole journey to London and back was extremely quiet. There was
You know what? I was just about you keep reading my. I was just about to ask you, what was it like on the train? I haven't been on the train in ages. What was,
It was so strange because I went
I
with
can imagine.
another very close member, Sukiyo Maikari member Iris, and the two of us were on the train, and she kept on saying it is so quiet, and it was
Mm.
absolutely quiet. There was hardly anyone on the train. We basically had like a whole carriage for ourselves.
Oh
um,
God.
so the train station itself was so quiet, and then getting into London was extremely quiet. It's so different from if you think about a year ago to how
Mm.
the trains were, even when you went to London, when
Yeah.
you and Jeff used to go, and I'm sure when Amy goes, it's so different. There's just no one around. It's very safe, and I think people have just understood and taken the guidance very strictly. That's what I felt. So going to the Mai Curry Center and back, I felt so safe.
Where's the center? Where is it? Which part of London
So
is
it's
it?
in Croydon, in Suffolk Road in Croydon.
Okay.
So
Okay.
it's
So did you have to travel from Milton Keynes to Euston, and then
yes, and then to
you?
Norwood Junction.
Oh, okay.
Yeah. So
All
taking
right.
the underground, and also taking the overhead, or you can go directly as well. There are trains that go.
Did you get on the, were you able did you get on the bus as well or not?
No, not on the buses, but
Okay.
just on the train. But
I'm kind of curious. I want to see what it feels like this time around to
I
travel in London.
I think you
You
need
know.
to try it. You need to go on the train ride. Definitely, we should go
Well, I will one of these.
because
Well,
it's definitely an experience. It's very quiet from the normal,
mm,
and so it was really safe. I must say that's what I think the whole point. What I felt was there's a lot less anxiety, less chronophobia. There's
mm,
more security and safety. When we go out, we want to feel safe. And if we need to go
yeah,
out, then we need to be able to feel safe. And I think that's so important, especially for our mental health, because anxiety, stress, coronaphobia, all of these are still very real for a lot of people.
mm,
Especially if they've had coronavirus, or if they're recovering from it, or they know someone that has had it, or someone that has died from it. So at least all of us would have experienced some form of it, or in some shape or form. So I
mm,
think going out and being feeling safe and keeping to the guidelines, I think for me it really feels that people are listening. So there's not many people that are just taking trips. I was
yeah,
actually very surprised because
yeah.
all this while I thought, I'm being very, very cautious, very strict, but actually the whole country is. It's not just me. So it's really good to see because people are taking it seriously. They're protecting themselves, they're protecting other people and vulnerable people. So it's good to see that the whole nation is actually just caring not only for themselves but everyone else, and for our frontline workers and essential workers. So it's good that people are, wearing masks, face coverings, maintaining social distancing, and also washing their hands, so and only going out unless absolutely necessary. And I think a lot of this also has to do with the fact that we've been in lockdown. So it's a mixture of us being in lockdown. It's a mixture of seeing that the figures are now going down because we're in lockdown, and because we've had now over 21 million people having the vaccine. And it's also been because people have realized that they need to take it seriously. So
Yeah,
it's a
I think it's
mixture
come
of
to that.
things.
It's come to that point where people have just realized that, look, I've got to do something because this thing is serious.
Yeah.
And that brings me to our next point, where in the news it's a marked decline in infections between January and February may have slowed, according to scientists tracking coronavirus in England. They are saying that infections have fallen by 2/3 over lockdown, which is such great news, and I believe that is. But there's a bit of fear here that when on starting Monday, when the schools reopen, and we might have a little, it might go up a bit. The good news for me, or the good thing for me, is the fact that the schools are they're putting stuff in place. They're putting things in place to care of it. For example, my daughter's school, for example, in London, she will have to get a negative test. Every student will have to get negative test within 72 hours, just like the travel and the traveling situation, before you go into school. And after that, you test twice a week. Okay, so you test twice a week, and you have to have your negative test certificate to go into school, which I think it's very stringent, but it's really good. So they're
That's
making
very
sure that
strict. How does she feel about
it's very
it?
strict. How does she feel about it? She's absolutely fine with it.
Good.
She's fine with it because she's of course she doesn't want to catch COVID, and with the situation that happened in her school earlier on, with more than 12 or 14 people getting it, and some of the teachers and all that. So she's fine with it. She wants to do the test. She wants to make sure that she's safe, and that's very responsible of her. And not just her, but a lot of her colleagues, her mates in school as well. They all want to.
That's amazing, Opoku. I'm glad to hear that Amy's feeling like that, because I was just a bit concerned. Obviously, subjecting young children and younger people, younger adults.
She's fine with it. She's done 2 or 3 tests already anyway, so she's fine with it.
So no, that's amazing to hear, and it seems like we are going in the right direction. We are heading in the. I really feel it's so much happier, so much relieved, and so much more optimistic. Like you, I'm sure that we've got guidance. People are getting so there's a combination of things happening. We're still in lockdown. We have the rollout of the vaccines. We have more control over the virus. The numbers are going down. Which is huge. So that's one of the headlines. As you've said already, the numbers have gone down significantly. We know also that there's a lot of testing going on, a lot of track and tracing. There's track and tracing is happening in all places. So anywhere you go in the UK, if it's a coffee shop, even to buy a takeaway, even if it's to any centers or religious centers or takeaway places, shops, everywhere they have track and trace signs. So there's signs all over, on the trains, all over. It's really visible. There's posters. There's a lot of awareness. So, and advertising around the vaccine, around the guidance, strict rule guidance of keeping yourself safe and wearing a mask, hand sanitizer, and washing your hands using hand sanitizers, and also maintaining social distancing. So that's all over. Even that's something which I wanted to just say, that there's so much more education, so much more awareness that when we started a year ago. So it's visible. So wherever you look, even on the train, there's signs for there's posters about social distancing. If you're in the waiting room in the train station, there's seats that are cordoned off. So there's certain seats saying that
Yeah.
leave the seat empty because it's for someone else, it's because of the social distancing. So it's all over. And then on the billboards, you got the signs for the vaccines where people are promoting taking the vaccine. So there's so much going on, even though there's not a lot of people around. It's just visible all over. We definitely, this is now the new normal we have to adjust to, with all
Yeah.
these guidance and environment being very different. I think also, just coming to the fact about, I was saying about the testing and also the hotel quarantine, that's another reason why we are seeing the numbers go down, and also so much less people out and about socializing.
Mm-hmm. Well, it's a good thing. I mean, if I went to the train station, for example, there's no way I would sit down. I'll just stand or hang around. I'm not. It's not that I'm too afraid of the thing. Yes, of course, everybody's afraid, and so am I. But it's just that I would just stand instead of sit down. Do you know what I mean? And I don't know. My mind keeps going to your trip to London, and
Oh, go on. I'd love to talk about it. It was really good. We should go on the train together. Well, I'll come and meet you, and we'll meet. We'll go on a train together, and you'll see it's so different.
Yeah, I'm yearning to do that. I might take a trip to London one of these days, just for the sake of it. Just travel to King's Cross or something, walk around a bit, and come back, so that I can also give a report on my.
Yeah, no, we should do a report together. We'll go on the train.
That would be nice.
Do some scouting, because you were the one going out all this time. So I'm like,
I know.
I'm more encouraged by you and your bravery and your courage. So I managed to go, because I know you had gone a few times already into London very early on, you and Jeff. So but before we talk about the London trip more, I don't know what you wanted to ask, but maybe I'll get your response on this. So falls in COVID deaths ahead of estimates as calls for quicker lockdown easing grow.
Can you repeat that, please?
So they say fall in COVID deaths ahead of estimates as calls for quicker lockdown easing grow.
I heard you the first time.
I know.
Time, and the reason I said if you can repeat it was because I was trying to get my head around it. Okay, well, you're throwing the question at me now. Let me try and see if I can answer it as honestly as possible. I think we shouldn't rush out of lockdown, but at the same time, things are getting better, so there should be some sort of coming out of lockdown, in small steps. That's what I'm thinking, and I have a feeling that's what the government's planning, or that's what the government's doing with all these, phases of coming out of lockdown. For example, like on Monday, the kids will start going to school, and then on the 12th of April, something will happen, and then on 17th of May, bit by bit, and then around June, something else is going to happen. I do not believe we should come out and like they're doing in Texas. Like, stop wearing face masks from next week and all that. I think it's a bit too early to do things like that. That's my personal opinion. At the same time, I totally understand how everybody feels being locked down for all this while, and businesses falling, especially small businesses. My heart goes out to pub owners, restaurant owners, and small businesses all around the UK who some of them are actually closing down because of the situation, because they can't go on anymore. And it's sad. So the earlier we come out of lockdown, the better. But at the same time, it's better to lose your business than to lose your life. That's my honest opinion.
A very well thought answer, very well articulated as always. I 100% agree with you. That's exactly what I would have said. I couldn't have said it better. Definitely, I think we shouldn't come out of lockdown quickly, because there is a concern, and I think the government will also go ahead with that, with such an approach. I think the strategy they will use is that even though numbers have gone down, we've seen a decrease in the number of deaths. So I think as of 24 hours, we've had 315 deaths. Every life matters. So the number of deaths have gone down, but I think they will be cautious, as you saying, that we should not come out of lockdown too quick. It should be done very strategically. It should be a graded plan, like the four-step plan, which they have already. And also, it needs to obviously have a robust testing, as we've been doing, track and tracing, rollout of the vaccine, also education and awareness to everyone about the COVID-19, and also with schools opening, I think it's really important that support for the students, for schools, for children, and for the teachers, because I think that's going to be a huge test, the next part of the easing of lockdown. So I do think, like you've said, the government, Boris Johnson and his team, they have, I've repeatedly said, they have been criticized very early on, because we had a large number of deaths, and we are number 5 in the world in terms of the figures. So it is huge. We are obviously still trying to come out of that, and they will be doing it very, very cautiously, which is good to know. And Boris Johnson also had COVID-19, so he knows exactly what it is. And I don't think he's going to just, ease lockdown too quickly. But yes, there is going to be pressure. So Downing Street, Matt Hancock, and Boris Johnson will be under a lot of pressure, I think, in terms of easing lockdown.
There's no doubt. There's no doubt that whatever you do, you're gonna be under a lot of pressure, because people are suffering, and people, in terms of business and work, people, the economy is suffering, and so people put pressure on you.
Yes.
I mean, if you are in charge of doing things, they're going to put pressure on you to ease lockdown and all that. Yeah. But then again, I don't think they should let the pressure get to them too much, because they have to think through it.
Yes.
Nice, properly, and easily, so that we all benefit, so that we save lives instead of lose them. So that's it. Shall we move on to vaccines? Yeah.
Yes, we should. Yeah, just to say, the Texas story you were saying, easing of lockdown, they are doing it despite warnings against it.
I know,
so that is a concern actually in Texas.
Well, it's probably political, to be honest. I'm not. I don't have any evidence to prove it, but it's probably because the governor is Republican and probably trying to spite the Democrats or not. Maybe that's not the case, but whatever the case is, I personally don't believe that they should stop wearing masks from next week. I don't think so. Anyway, so the new COVID vaccines to fight the variants, like the Brazilian one, can be fast-tracked through the approval system, says the UK's regulator. Okay. Now, he has issued guidance along with authorities in Australia, Canada, Singapore, and Switzerland on what checks and measures would be necessary. It includes proof that the shots trigger protective antibodies in the blood, but not lengthy trials.
Yeah.
So, would you say that the fast tracking of these vaccines is good? You think it is?
Well, that's what they're saying. They're saying that fast tracking gives a new hope for the mutant strain protection as the vaccine delivery is announced. So from the information that we have, this is what they're saying, that obviously we know we are concerned about the different variants. So the Brazilian, the UK, the South African, and a few others, the Nigerian, Denmark, Norway, those type of variants that we've seen. So obviously there is a concern with the variants, but they're saying that if the virus, obviously, there's a variant study that's been done, which gives good hope that against protection. So so it's saying that so they're working in partnership with different countries And obviously, it's still early days to know how much more it's going to impact. But it says, but obviously, the information is that it is supposed to be, sort of hopeful for us. I don't know what you feel on that.
Well, I don't know. What bothers me is the fast tracking of it without going through the stringent measures. But desperate measures, or desperate situations call for desperate measures, really. So in a way, it's got its good side and the bad side. And the good side is that we're desperate now, so it's okay to fast track it. But at the same time, for it not going through stringent measures and the proper tests and all that. But I'm sure that it will not just be, even though they're going to fast track it, it will not just be, they will not just forget about doing certain things. I'm sure they're going to do what is right, because let's face the truth. These variants are dangerous, man.
Yes. Well, that is a concern. Yeah.
Yeah, they're dangerous, and they're super spreaders, man. They're spreading so fast. So something's got to be done.
Yeah.
And I think, I do trust the scientists, to be honest with you, and I know that they're doing everything they can to get on top of this variant mutation situation.
Yes.
So yeah. Yes. I'll give it to them. I think it's fine. I think it's okay. I think we'll be all right.
Yes, I think we are. They're actually saying that early vaccine data suggests that Britain won't need another lockdown.
Ooh, hallelujah.
So that's what they're saying, that it seems that Matt Hancock is told that the number of hospital admissions have halved every day for 15 days. And the number of deaths have been decreased as well. So it seems that we are definitely going to be seeing the possibility that this will be the last lockdown. I mean, that will be amazing news if that is the case. But I think it is possible.
Absolutely.
I think it is really possible. That is possibly true. I just want to go back to the businesses, because clearly when I went to London, a lot of places were closed. There were lots of places that were open, but lots of businesses were closed. And the places that were open, you couldn't go and sit down. So even if you wanted to go for coffee, we went past Costa Coffee and Community Vegetarian Place. None of these places you could actually sit down. So you had to get a takeaway if you wanted anything. So I think people are actually, I think even owners are quite scared to go against the guidelines.
Sorry, let me just cut you quickly before I forget what I was about to say. You mentioning Costa. I went into town the other day, into Bedford town, went to the bank, and I just decided, let me just go into Costa and get a coffee. And so I went into Costa. There was nobody there except two of the staff. Lovely people they were. They welcomed me nicely. I ordered my coffee, and you know me, I like to chat and ask questions and all that.
Like me.
So I said to the lady, oh, it's quiet in here. She said, yeah, I said, oh, you must be missing the crowd, like people, because of course you're not allowed to sit down, so you just get your coffee and you get away.
Yeah.
And she said, I tell you what, I don't miss it. I like it this way. I said, really? She said, yeah. Apart from it being safe, it's nice to just stay in here. And one or two people just walk in, and then she said, don't get me wrong, I'm not a lazy person at all. I like working.
Yeah.
But I like it this way. And so, we just had a little chat, and I got my coffee and I walked out. It was almost like they were trying to tell me, okay, you got your coffee? Go out, And that was cool. That was really cool.
I love that,
Continue with your story about London. There's nothing, all the shops shut in London and all that.
No, I mean, your experience of Costa Bedford was exactly the same as in London. You have to get in They've got a track and trace sign. They've got the social distancing. Everything's cordoned off. You cannot sit down. So all the places, that we would usually go in that area near the Secure Maikari Center, everything, all the coffee shops, everything is open, but you can only go in, get your food or drink, and take a takeaway. And I'm not surprised that she said it's, they enjoy it being like that, because it is, honestly, it's so different. And I think
it's just different than the session. That same day, another story. I'm full of stories on that. I've got a lot of experience.
I know.
That same day, I wanted to go and get pomade for, like the Morgan's pomade.
Yes.
And so this particular shop where they sell hair products and pomades and moisturizers and all that in Bedford town. And so I said, I realized that it was open. So I said, let me just go and get it. As soon as I got to the door, the man came, and there was a big box right in front of the door, blocking anybody, blocking people going in.
Wow.
And so I said, well, are you not open? He said, yes, we are open. I said, so why the box? I mean, can I come in? He said, no, you can't. I said, why? And then he said, we are being strict. We're taking precaution. Yeah. You just give me a list of what you want. I'll get them for you. And I thought that was really cool. I thought that was cool. I just said, I just want a bottle of Morgan's. And then he brought it. And I couldn't even pay with the card because the card machine was inside, and he couldn't bring it for me to tap it. So for me, no, because I needed to put the pin in.
Yes.
And he said, no, you can't do that. You'll have to give me your card, and then I'll tap it for you. And I said, this particular card can't tap. So I had to change the card and give him another one so that it taps it. And he was wearing gloves all this while,
Yeah.
He would just wear the glove, take a card, tap it, take the glove, and give it back. You take the gloves off, and wear another pair. And I thought, this is nice. This is really
amazing,
good.
Amazing. That is so good to hear. Because the people are, what? I've heard a few stories, a few people where some people are working in different shops. I don't know which supermarket or which shops, but I've heard that this one person said that, they contracted it and the whole family contracted COVID.
Yeah.
So, working on the front line, not just in healthcare sector, in the hospitals and clinics and GP practices, but also people that are working in the shops, we're so grateful to them to be open, but they're putting their lives on the line, so they do need to take precautions. So I'm not surprised that this person told you not to come in, because people are scared. They are scared for their safety, and also it's to keep you safe as well, because you must understand they're in contact with so many people. How many hundred people go into a shop at a time, or a few, 20 or 30 or more. So it's important that people take these measures, because imagine if everyone went into the store, some of them had COVID-19, then you contracted because you're in that environment. So I think it's really good that people are taking those precautions. I just want to say one thing. I know we have to do the numbers, but there were 2 people I noticed in the area near the center in Croydon that didn't have the mask.
Okay.
Yeah, there were 2 people walking, and one person was even coughing and didn't have a mask on. So I did notice that there are some people that are still not listening, but majority of people are listening.
Yeah. All right, let's do the numbers quickly. We've only got 3 minutes to go, so we have to kind of rush through it.
Okay, the Worldometer.
We're just enjoying the chat, one week.
I know. We can talk a lot. We'll have to talk again tomorrow about London.
Yes,
so
absolutely.
Because there's just so much to talk about still. So in terms of the figures of the Worldometer as of today, the 4th of March 2021, globally, the figures is 115,795,007 positive cases around the world. Number of deaths, 2,572,193 deaths. Total recovered, 91,494,523 that have recovered. USA number 1 with 29,456,377. So they're nearing 30 million.
Yeah.
With 531,652 deaths. India.
Have you noticed
Yeah.
though that even though the US they've got 531,652 total deaths, have you noticed that it's actually slowed down?
Yeah.
Because
It has.
if you know, a couple of months ago it was going up like crazy.
Yeah.
You know, but since it got to 500,000, it's slowed down a bit.
Exactly.
Yeah, okay, let's go. Yeah,
exactly, that's the truth. So yeah. So India, I'll just go again, 11,156,923 positive cases with 157,471 deaths. Brazil number 3 with 10,722,221 positive cases with 259,402. Russia number 4 with 4,278,750 positive cases with 87,348 deaths. UK number 5 with 4,194,785 positive cases with 123,783 deaths. And Ghana number 88 in the world with 84,349 positive cases with 611 deaths. So it's gone up with some deaths. And South Africa I've just missed, which is number 16 in the world with 1,516,262 positive cases with 50,366 deaths. And the figure in the UK the last 24 hours has been 350 new deaths with 6,385 new cases. And yeah, so the figures are going down. Just to say, we can talk tomorrow, but Ferdinand was actually the one that was a bit cautious yesterday and asked me whether I definitely wanted to go into London. So, because he was a bit more concerned about going into London. So, something we can chat about tomorrow.
Okay. Thank you very much, Dr. Seshni.
Thank you, Hope. We have a fantastic day. Lots of love to everyone, and let's spread the love and not the virus.
Fantastic. Okay. And that was Dr. Seshni.
Thank you, everyone, for joining, and hope you have a fantastic day. Lots of love from my family to yours, and stay safe wherever you are in the world. Namaste.